Well, it's been nearly 2 months since Kinew was sworn in as Manitoba's 25th premier. The ceremony marked what he called the dawn of a new day for this province. Kinew said fixing healthcare would be his top priority. The government announced yesterday it had found $123 million in savings. Today, we have our regular monthly interview with Premier Kinew, who joins us live in studio. Good morning.
Good morning and happy holidays.
Happy holidays to you. So let's get into that $123 million in savings that came from canceling the surgical wait times task force, partly from that. We heard some people who were, looking forward to getting surgery outside the province who might be worried now they'll have to wait even longer. What would you say to them?
We're investing in surgeries here in Manitoba. So I think one of the things that didn't make sense about the previous government's plan is how is driving further going to get you seen quicker? And so instead of paying American clinics out of province services, we're investing that here in Manitoba. And by the way, in winding down the task force, $8 million in bureaucratic costs we've saved. The same amount, $8 million, is what we're investing in expanding hospital beds at sites like the Grace, which we all hear day after day really, really need those investments because of the struggles in the emergency room and the struggles that staff are having to do their really, really important work. So we're a couple months in here, and I think we're making good on our promise to reduce the abundance of bureaucracy at the top levels of the healthcare system and returning those resources to the front lines where it actually serves you, the patient.
But wasn't one of the reasons the task force was there, sending people south of the border because you can't get any service any quicker? How are you going to suddenly have quicker surgeries?
The surgical teams at the Concordia Hospital and the Grace are nationally recognized. Some of the best surgeons in the country. The reason why they're not able to perform as many surgeries as they would like is because Stephenson and Pallister, over their time in government, closed the emergency rooms at the Conc and the other sites. And as a result, we don't have the ability to do those more complicated joint surgeries. That contributed significantly to the surgical wait times in our province. So what are we doing with the savings that we started off this interview talking about? We're investing that into more resources at the Conc and the Grace so that they expand capacity. So basically, we're making a choice. Instead of investing in the States, we're investing here in Manitoba. That's going to get you seen more quickly if you're on a wait list for a surgery, but it's also going to invest in our overall public healthcare system here in Manitoba, which is what we need to do because, these challenges in surgeries and emergency rooms, they're not going to get fixed overnight. This is a years-long project that we're embarking on. But I think the first step is to start laying the foundation with some good investments here at home in Manitoba.
So in the meantime, people may have to still wait longer. But moving on with the healthcare plan, part of that was to change the culture of healthcare in Manitoba. You said you would talk to healthcare workers directly, and you did that last week at Grace Hospital.
Yep, first up.
And you said you got an earful. What have you heard so far?
Well, I think that there are heroic efforts from the people on the front lines, the nurses, the staff who clean the equipment, who bring it to the operating room, the surgeons who are operating there, the ER physicians, the psychiatrists, everyone is doing their best. But what we've seen, and because of the decisions made by the previous government, is that there's just a lot that needs to get cleaned up in the way healthcare is administered. The people on the front lines are doing heroic work. They're doing their best, but we just don't have the right mix of resources in place to meet you, the patient, when you show up at an emergency room, when you get referred for a surgery, when you get referred for an MRI. And so this is going to take a long time to fix, but in the first couple months, our health minister and the rest of our team have done some really important work to bring a mobile MRI into place for northern Manitoba, to add more surgical capacity at the Grace and Concordia, to invest in beds at the hospitals that have emergency rooms, because the waits in the ER are caused by and large by not having beds in the rest of the hospital for people to move out of the ER and then get the care in that other part of the hospital. So we're setting about a plan to make these investments, but we also know that if you look at healthcare in Manitoba, we're spending more money than ever. And yet the outcomes for you, the patient, are getting worse. Wait times are growing, right? So something needs to change. And that's why we talk about culture. because we're dealing with a workforce, the nurses, the staff, the physicians, the healthcare professionals, who by nature are willing to go above and beyond. That's their calling. However, when we disrespect them, when we don't respect their expertise, when we take decision-making power away from them on the front lines, that leads to disillusionment, it leads to burnout, it leads to people leaving the workforce. And so we're going to focus on the culture of healthcare, meaning respecting the front lines, listening to their suggestions, and then implementing those fixes locally.
Mm-hmm. And meanwhile, your government is forecasting a deficit of $1.6 billion. That's more than quadruple the estimate we got back in the spring. And you say the province found that $123 million in savings this fiscal year, but you still don't plan to reduce the deficit. Why not?
We are planning to reduce the deficit. The PC government, Stephenson, on her way out the door, knew this situation was the reality fiscally. And I think we all knew that they were trying to spend money to win back support in the lead up to the election, but I don't think any of us realized the actual price tab that was being run up. It's $1.6 billion. If that administration had been allowed to continue through the rest of the fiscal year, the deficit would be much higher than what it is today. So we've found some savings right now to stop the deficit from increasing. We've found further savings to be able to invest in things like healthcare, like to be able to cut the provincial fuel tax to save you money after the holidays. And the number that was shared yesterday is a number up to December 1st, because these are basically audited books that are signed off on by the technical experts in government. I can tell you that as we stand here today, the number is better. So we continue to do our work in government to be fiscally responsible, but also to have a balanced approach. Balance meaning, yes, we're going to wrangle with the deficit that we inherited from the previous government, but we're also going to invest in services like healthcare. And of course, we're going to focus on making investments that grow the economy. Mm-hmm. So we have to focus on all three of those things together to have the right mix and balanced approach.
Well, and I guess like what you're saying is by finding those savings, it keeps the deficit from growing any further. But I mean, that's a big number, $1.6 billion. I mean, what kind of tax hikes might we see in light of this deficit and all the promises, including cutting the gas tax for 6 months starting in January?
Well, we are making good on our election promises. You know, when I go to Home Depot or Walmart and people, stop and share some encouraging words, one of the things that they often say is that we think you're going to keep your promises. And that matters to people. And so we're less than 100 days in to government, and we are investing in the hospitals with emergency rooms. We're investing in healthcare to bring it closer to you, the patient, where you live. And we're also honoring our commitment to cut the provincial fuel tax to save you money after the holidays. So provincial government can't do everything, but by restoring fiscal responsibility and by making targeted investments in the cost of living and in healthcare, I think we're taking some really, really good steps that are starting to move things into a more positive direction for the province of Manitoba.
Mm-hmm. But won't that take a tax hike at some point? I mean, that's a lot of money to make up for.
This is PC messaging, because they were never willing to make the tough decisions. And I think our team is going to make a balanced approach a reality here in Manitoba. We're going to be fiscally responsible, which means doing a lot of internal work, tightening the belts within government and being responsible. We're going to make the investments in healthcare and in the economy. And then we're going to make some targeted investments in future job-creating opportunities that I think are going to grow more opportunity for the good people of this province.
Okay. Meanwhile, the opposition has accused your government of inflating that deficit number to make them look bad. And you've mentioned it a few times. Well, let's hear from finance critic Abhi Khan from yesterday.
If the deficit was what they claim it to be, why not apply that $125 million to the deficit? They want to talk about holding the line. Well, you're not holding the line if you're looking to move money to pay for $3 billion in promises.
How would you respond to the finance critic?
He and Heather Stephenson created this $1.6 billion deficit. They have zero credibility in terms of trying to criticize us for this. Yesterday, in advance of the press conference we held, we had a technical briefing where we invited every journalist, any columnist, anyone into the building to sit down, not with the politicians, but with the finance department and Treasury Board staff and ask any question you want. Poke and prod at these numbers. These are real numbers. For folks who watch this issue carefully, I will say this. Look at the Manitoba provincial debt to GDP ratio. It has deteriorated as a result of this being a real deficit number. This is not inflated. This is a number that we walked into when we formed government. Now, for us, we have to have a balanced approach, which does mean wrangling with this deficit number left to us by the PCs, but we still have to move ahead with investing in healthcare. This is the number one priority for people in Manitoba. And of course, in the long run, one of the important solutions is going to be to grow the economy. So we still have to make those necessary investments in terms of creating a brighter future for tomorrow.
And another priority for some people is homelessness in Manitoba. We know 2 people died earlier this week in a tent in Point Douglas. And Housing, Addictions and Homelessness Minister Bernadette Smith says she doesn't want to open any more shelters. She says they're a Band-Aid fix. So what solutions are you proposing and when?
It's really sad when we hear people losing their lives in this kind of way. I think all of us, just on the level of humanity, when we drive by bus shacks or we see encampments, which are outside downtown Winnipeg today, I would add. This is in South Pembina, West Winnipeg, Brandon, major issues in Thompson, other parts of the province that haven't seen this before. I would say that this is one of the top priorities that I've heard from Manitobans from all walks of life. And at the end of the day, the goal is I want you to come downtown to a hockey game, to a concert, to get a bite to eat, and feel proud of our downtown, to feel proud of Thompson's downtown, proud of Brandon's downtown. The way that we do that is by bringing everyone together to buy into one plan around homelessness and to remove the barriers and the silos that exist. And so that's the work that we're in the early days of. But the good news is we have a really good working relationship with the mayor of the city of Winnipeg and other municipal leaders across the province. Good relationship with the federal government, very strong relationship with the business community who care passionately about this issue. And of course, good relationships with the not-for-profit sector. So we're going to stand up housing. But the provincial government cannot stand up new social housing quick enough to deal with the humanitarian crisis we see on the streets. So we're also going to have to look at the existing housing stock. We're going to have to work with landlords. We're going to have to work with property owners, with municipal governments, with the feds to figure out how can we get people off of the streets and out of bus shacks and into housing situations as quickly as possible, and then to ensure that they have the wraparound supports, addictions, mental health, hopefully also pre-employment and job programs for some, so that they can be successful once they do move into that housing unit. And this, again, is going to be a long-term approach, but it's something that we've started on right now.
All right, so we just have a little bit of 25 seconds left, and here's the hardest hitting question of all. Do you have any holiday plans?
You know, I love the holiday season, the generosity that we all get to celebrate, the visiting, the food. And so I'm very much looking forward to spending a lot of good time with our friends and family, and of course to be on the rink skating with our kids.
We'll have a great holiday season,
Happy
Premier.
holidays to you.
That was Premier Wab Kinew. He was joining us in studio.
Thank you for watching the CBC Manitoba YouTube channel. Don't forget to like and subscribe. For the latest breaking news and top stories, download the CBC News app.